Welcome back to another deep dive. Don't forget to like and subscribe to Visions Beyond. And leave a comment if you have an idea for a topic you'd like for us to cover sometime. Today we're taking a deep dive into the common cold versus the flu.
Okay.
To help us decipher between these two sneaky culprits,
Right. Okay.
we'll be referencing articles from the CDC, the Cleveland Clinic, the MSU Healthcare Pharmacy, NIH News and Health, and WebMD. It's funny how often people use the terms cold and flu interchangeably, but they're actually caused by totally different viruses.
That's right. Yeah, it's a common misconception.
Yeah.
The cold can be triggered by over 200 different viruses, with the rhinovirus being the most prevalent. Imagine it like a massive viral gathering, open to all. The flu, on the other hand, is a bit more selective. It's caused specifically by influenza viruses.
So two distinct guest lists for these viral parties.
Yeah.
But how can we tell who's crashed your system based on the symptoms? They can be so similar, it's like they're playing a game of guess who with our immune systems.
Exactly, and that's where the real challenge lies. They can mimic each other so well
Right.
that relying solely on symptoms can be misleading.
Yeah.
But there are some telltale signs that can help us differentiate between them. For example, a cold often starts slowly with a scratchy throat or a runny nose. You might feel a bit tired and have a mild cough. It's more of an inconvenience than a complete system shutdown.
Like a guest who overstays their welcome but doesn't trash the place.
Precisely. The flu, however, is a different beast altogether. Think of it as a sudden home invasion, with symptoms like high fever, chills, body aches, headache, and fatigue hitting you hard and fast.
Wow.
That sudden onset, particularly the high fever,
Yeah.
is often a key indicator that you might be dealing with the flu rather than just a cold.
So it's the speed and intensity that differentiates the flu from a common cold. That's really interesting. And speaking of timelines, how long does each of these unwelcome guests typically stick around?
Well, a cold usually runs its course in about 7 to 10 days. The symptoms gradually develop over a few days and then slowly subside. The flu, however, can linger for a bit longer, sometimes up to 2 weeks. It's known for leaving you feeling drained and wiped out, even after the initial symptoms have faded.
That makes sense, given the flu's more aggressive nature.
Right.
But it makes you wonder why the flu tends to knock us down for longer. Is it something about the influenza virus itself?
You're hitting on a crucial point. The influenza virus is particularly adept at attacking the cells that line our respiratory tract, leading to more widespread inflammation and damage. This can explain the more intense symptoms and longer recovery time associated with the flu.
That's fascinating. So the flu isn't just about the symptoms themselves. It's about the underlying impact on our respiratory system.
Oh.
Okay, so we've got different viruses, different onset patterns, and different durations. But how do we know for sure which one we're dealing with? Is it just a guessing game, or are there ways to confirm the diagnosis?
Well, sometimes even experienced doctors can find it tricky to differentiate between a cold and the flu based solely on symptoms. That's where testing comes in.
Testing. So there are tests that can tell us definitively whether we have a cold or the flu.
Absolutely. Tests like the rapid flu test and PCR tests can detect the specific virus causing your symptoms. The rapid flu test, as its name suggests, can provide results in a matter of minutes, making it a valuable tool for quick diagnosis. PCR tests, which stand for polymerase chain reaction, are more sensitive and can detect even tiny amounts of viral genetic material. They might take a bit longer to process, but they provide very accurate results.
So it's like having a detective on the case, identifying the culprit behind our misery. I never knew there were tests that could pinpoint the specific virus.
Yeah, it's an important tool in our arsenal, especially when we need to confirm the diagnosis and determine the most effective treatment approach. And speaking of treatment, there's a common misconception that antibiotics can cure a cold or the flu. This simply isn't true. Antibiotics are designed to fight bacteria, not viruses.
Ah, that's right. I remember learning that back in biology class. So if antibiotics are off the table, what can we do to alleviate those miserable symptoms when a cold or the flu strikes?
Well, while there's no magical cure for either, there are plenty of ways to manage those pesky symptoms and support your body's natural healing process.
Okay, spill the secrets. What are your top tips for feeling a bit more human when those viruses come knocking?
Well, first and foremost, listen to your body and prioritize rest. Give yourself permission to slow down, take a break from your usual routine, and allow your immune system to focus its energy on fighting off the virus. Think of it as a timeout for your body.
It's like hitting the pause button on life for a little while. Sometimes that's easier said than done, especially in our always-on society, but I know it's important. What else can we do besides rest?
Staying well hydrated is crucial.
Okay.
Think of it as flushing out those toxins and helping your body function at its best. Water, broth, herbal teas, they all count.
Hydration is like giving your immune system a refreshing boost. And I've always heard that good old-fashioned chicken soup can help too. Is there any truth to that, or is it just an old wives' tale?
Actually, there's some scientific evidence to back up the soothing powers of chicken soup. It acts as an anti-inflammatory and can help thin mucus, providing relief from congestion. Plus, it's warm and comforting, which can be a psychological boost when you're feeling under the weather.
So chicken soup is a win-win. Comforting and potentially therapeutic.
Now, what about those over-the-counter medications that line the pharmacy shelves? Are they worth trying, or are they just masking the symptoms?
Over-the-counter medications can be helpful in relieving specific symptoms, but it's important to remember that they don't actually shorten the duration of the illness. They're more like temporary painkillers for your immune system.
Right, they're not going to magically make the virus disappear, but they can make the experience a bit more bearable. What about things like decongestants, cough suppressants, and pain relievers? Are those safe to use? They can be helpful for short-term relief, but it's always a good idea to talk to your doctor or pharmacist about which ones are right for you, especially if you have any underlying health conditions or are taking other medications.
Okay.
They can help you choose the most effective and safe options for your specific situation.
That's great advice. It's always better to err on the side of caution and get professional guidance. Now, I know we've been focusing on conventional treatments, but what about natural remedies? Are there any alternative approaches that can help alleviate cold and flu symptoms?
Absolutely. There are a number of natural remedies that have been used for generations to soothe those aches, pains, and sniffles.
Like what? I'm always curious about natural approaches to healing.
Well, gargling with salt water can help reduce inflammation and clear out mucus in the throat, providing relief from a sore throat. Warm tea with honey can also soothe a scratchy throat and act as a natural cough suppressant. And for those battling congestion, a humidifier can be a lifesaver. It adds moisture to the air, making it easier to breathe.
So many natural remedies to try. It's like having a whole arsenal of weapons to fight those cold and flu symptoms. But I imagine it's important to use these remedies in conjunction with rest and hydration, right?
Exactly. Think of it as a holistic approach to healing. You're supporting your body's natural defenses while also addressing specific symptoms.
That makes sense. It's all about creating an environment where your body can heal effectively. Now, I know we've been talking about how to manage symptoms, but what about preventing these illnesses in the first place? Are there any proactive steps we can take to minimize our risk of getting sick?
Absolutely. Prevention is key, and there are a number of simple yet effective strategies that can significantly reduce your chances of catching a cold or the flu.
Okay, let's dive into those prevention strategies. I'm all ears. What are the most important things we can do to stay healthy during cold and flu season?
Well, first and foremost, make hand hygiene a non-negotiable habit. Wash your hands thoroughly and frequently throughout the day, especially before eating, after using the bathroom, and after being in public places. And if soap and water aren't readily available, an alcohol-based hand sanitizer can be a lifesaver.
Hand washing. It's so simple, yet so effective. I remember learning that hand washing is one of the most powerful ways to prevent the spread of germs. But how does it actually work? What's the science behind it?
When we wash our hands with soap and water, we're not just rinsing away dirt and grime, we're actually disrupting the viral transmission cycle.
Wow.
The soap molecules work to break down the outer layer of viruses, essentially disarming them. And the friction from rubbing our hands together helps physically remove these deactivated viral particles from our skin.
Wow, I never thought about it like that. So it's not just about cleanliness, it's about physically removing those viral invaders from our hands. And that's why hand sanitizer can also be effective, right?
Yeah.
Because the alcohol in the sanitizer essentially disarms the virus, even if we can't physically wash it away.
Exactly. Hand sanitizer acts as a backup when soap and water aren't available, providing a quick and convenient way to reduce the number of germs on our hands.
So hand hygiene is our first line of defense. What other preventive measures can we take?
Avoiding close contact with people who are sick is another crucial strategy.
Mhm.
This might involve steering clear of crowded places during cold and flu season, politely declining hugs and handshakes, and even wearing a mask if you're feeling under the weather. It's all about minimizing exposure to those respiratory droplets that can carry viruses.
It's like creating a protective bubble around yourself. And I imagine that covering coughs and sneezes is also essential, right?
Absolutely. It's not just about good manners, it's about preventing the spread of germs. When we cough or sneeze, we expel a cloud of respiratory droplets that can travel several feet and linger in the air for a while.
Wow.
Covering our mouths and noses with a tissue or our elbows helps contain those droplets and prevent them from contaminating surfaces or infecting others.
So those tissues and elbows are like shields, protecting those around us from our own germs. I never realized how far those droplets could travel. Now, I know we've talked a lot about preventing the spread of germs from person to person, but what about those sneaky viruses that lurk on surfaces? How do we protect ourselves from those?
It's all about being mindful of what we touch and practicing good hygiene. Viruses can survive on surfaces like doorknobs, countertops, and phones for hours, so it's important to clean and disinfect these surfaces regularly. You can use household disinfectants or a simple solution of bleach and water to kill those lingering viruses. And remember, avoid touching your eyes, nose, and mouth with unwashed hands. That's a prime way for viruses to enter our bodies.
It's like those viruses are playing a game of tag with our immune systems.
Right.
They're constantly looking for an entry point, and we have to be vigilant about blocking those entry points.
Exactly. It's all about staying one step ahead of those crafty viruses. And don't underestimate the power of a healthy lifestyle in boosting your immune system's defenses. Eating a balanced diet, getting enough sleep, managing stress, and engaging in regular physical activity. These are all ways to strengthen your body's ability to fight off infections.
So it's not just about avoiding germs, it's about creating an internal environment where our immune systems can thrive. It's like giving our bodies the tools they need to win the battle against those viral invaders.
Well said. It's a holistic approach to health and well-being.
I love that perspective. Now, before we move on to our next segment, I wanted to touch on something that's been on my mind. We've been talking a lot about colds and the flu, but what about COVID-19? I know it's a different virus altogether, but I can't help but wonder how it fits into this whole discussion about respiratory illnesses.
That's a great question, and it's certainly a topic that's been top of mind for everyone in recent years. COVID-19, caused by the SARS-CoV-2 virus, is a newcomer to the respiratory illness scene, and it's presented some unique challenges.
Absolutely. I remember when COVID-19 first emerged, there was so much confusion and uncertainty. It seemed like everyone was scrambling to understand this new virus and how it differed from the cold and the flu.
It was a steep learning curve for everyone, from healthcare professionals to the general public. One of the initial challenges was that COVID-19 can share many symptoms with both the cold and the flu, making it difficult to differentiate between them based on symptoms alone.
I remember hearing about people experiencing fever, cough, fatigue, headache, sore throat, congestion, all symptoms that could be attributed to any of these illnesses. It must have been a nightmare for doctors trying to make an accurate diagnosis.
It was definitely a complex situation, and it highlighted the importance of testing as a tool for accurate diagnosis and effective treatment.
So even though COVID-19 is a distinct virus, it can present with symptoms that mimic the cold and the flu, making testing even more crucial in determining the cause of our respiratory woes.
That's fascinating. It's like those viruses are all trying to outsmart our immune systems and throw us off their trail. Precisely. They're masters of disguise. But with careful observation, awareness of key differences, and the power of testing, we can unveil their true identities.
This has been an eye-opening conversation. We've learned so much about the different viruses that cause colds and the flu, the ways they spread, and the steps we can take to prevent and manage these illnesses.
It's all about empowering ourselves with knowledge and understanding so we can make informed decisions about our health and well-being.
Absolutely. And speaking of informed decisions, I think it's time to move on to our next segment, where we'll delve deeper into the potential complications that can arise from colds and the flu. It's important to be aware of these potential risks so we can take appropriate steps to protect ourselves and those around us.
I couldn't agree more. Awareness and knowledge are our best defenses against these common, yet potentially serious illnesses.
Stay tuned, everyone. We'll be right back after a short break.
Sounds good. Welcome back. Now, while most cold and flu cases resolve on their own without any lasting effects,
Right.
there are situations where complications can arise.
That's a bit concerning. I always thought of colds and the flu as just annoyances, not something that could lead to more serious problems.
It's true that most people recover without incident,
Right.
but for some individuals, these illnesses can trigger a cascade of events that can be quite serious. For instance, the flu can sometimes lead to pneumonia, which is an infection of the lungs. This can be especially dangerous for older adults, young children, and people with weakened immune systems.
Pneumonia sounds scary. What are some of the warning signs that someone might be developing pneumonia after having the flu?
Keep an eye out for difficulty breathing, chest pain, and a high fever that doesn't respond to medication. If you notice any of these symptoms, it's crucial to seek medical attention immediately.
So those seemingly innocent flu symptoms could actually be masking something much more serious. That's a good reminder to always pay attention to our bodies and seek help when something feels off.
Exactly. Early intervention can make a world of difference in preventing those complications from escalating.
Now, aside from pneumonia, are there any other potential complications we should be aware of?
The flu can also lead to bronchitis, ear infections, and sinusitis, which is an inflammation of the sinuses. While these complications are less severe than pneumonia, they can still be quite uncomfortable and disrupt your daily life.
So it's not just about feeling miserable for a week or two. These viruses can have a ripple effect leading to other health issues.
And it's not just the flu that can cause complications. Even a cold, while generally milder, can sometimes trigger an asthma attack in people with asthma, or it can develop into bronchitis or sinusitis if the infection spreads.
Wow, I never realized that even a common cold could have such far-reaching consequences.
It's a good reminder that even seemingly minor illnesses can sometimes pack a punch.
So what's the takeaway here? When should someone decide to seek medical attention? I imagine it's better to err on the side of caution.
Absolutely. If you have any concerns about your symptoms or if they seem to be getting worse, it's always a good idea to consult with a healthcare professional. They can assess your situation, determine if any complications are present, and recommend the appropriate course of treatment.
It's like having a medical detective on your side, helping you decipher those confusing symptoms and ensuring you receive the right care.
Exactly. They have the expertise and tools to identify those red flags and guide you towards a safe and speedy recovery.
Speaking of red flags, are there any specific symptoms that should prompt a call to the doctor or a trip to the ER?
Absolutely. Difficulty breathing or shortness of breath, chest pain or pressure, a high fever that doesn't come down with medication, severe weakness or dizziness, worsening symptoms, dehydration, and any signs of potential complications like those we just discussed should all be taken seriously. Don't hesitate to seek medical attention if you experience any of these.
It sounds like it's all about trusting our instincts. If something feels wrong, it's probably best to get it checked out.
You're absolutely right. It's always better to err on the side of caution when it comes to your health.
Now, I want to shift gears a bit and talk about something we touched on earlier, the psychological impact of feeling sick. It's easy to focus on the physical symptoms, but I think it's important to acknowledge the mental and emotional toll these illnesses can take as well.
That's a great point. We often overlook the psychological effects of feeling under the weather. Feeling sick can drain our energy, disrupt our sleep, and make it difficult to concentrate. It can also affect our mood, leaving us feeling irritable, anxious, or even depressed.
It's like a domino effect. The physical symptoms trigger a cascade of emotional and mental challenges.
And it can be especially tough for people who are used to being active and productive. Suddenly, having to slow down and take a break can be a real adjustment, both physically and mentally.
So what advice do you have for people struggling with the psychological impact of being sick? How can we take care of our mental health while we're battling those physical symptoms?
First and foremost, be kind to yourself. Give yourself permission to rest and recuperate without feeling guilty or pressured to push through. Recognize that feeling unwell is a temporary state, and it's okay to take a step back from your usual responsibilities.
It's like giving yourself a mental break, a time to recharge and heal without judgment.
Exactly. And don't be afraid to reach out for support. Talk to friends, family, or a therapist about how you're feeling. Sharing your experiences can help alleviate those feelings of isolation and loneliness that can often accompany illness.
It's a reminder that we don't have to go through this alone. There are people who care and want to support us during these challenging times.
And remember, there are things you can do to boost your mood and well-being even when you're not feeling your best. Engage in activities that bring you joy, whether it's reading a book, listening to music, watching a movie, or spending time with loved ones. Even small acts of self-care can make a big difference in how you feel.
It's all about finding those little pockets of joy and comfort amidst the discomfort of being sick.
And don't underestimate the power of laughter. Watch a funny movie, share a joke with a friend, or simply reminisce about a happy memory. Laughter truly is the best medicine, as they say.
I love that. Laughter, connections, self-care, these are all essential ingredients for a holistic approach to healing, both physically and emotionally.
And don't forget the importance of perspective. Remember that feeling sick is usually a temporary state.
Right.
Your body is incredibly resilient and has an amazing ability to heal itself.
Yeah.
Focus on the positive. You're on the road to recovery, and you'll be back to your old self soon enough.
That's such a reassuring message. It's easy to get caught up in the misery of the moment, but it's important to remember that this too shall pass.
And when you come out on the other side, you might even find that you've gained a newfound appreciation for your health and well-being.
That's a beautiful thought. Sometimes it takes experiencing illness to truly appreciate the gift of health.
And speaking of health, I think it's time to move on to our final segment where we'll recap some key takeaways and empower our listeners with actionable steps they can take to stay healthy, protect themselves from these common respiratory illnesses.
I'm excited to delve into those practical tips and strategies. After all, knowledge is power, and the more we understand about these illnesses, the better equipped we are to prevent and manage them effectively.
Absolutely. Let's arm our listeners with the tools they need to navigate cold and flu season with confidence and resilience.
Welcome back to our final segment. We've covered a lot of ground in this deep dive, exploring the differences between colds and the flu, delving into potential complications, and acknowledging the psychological impact of feeling sick. Now, let's shift our focus to empowering our listeners with actionable steps they can take to stay healthy and protect themselves from these common respiratory illnesses.
That's a great segue. After all, knowledge is only as good as its application. So let's recap some key takeaways and translate them into practical strategies for our listeners.
I love that approach. So where do we begin? What are some of the most important things people can do to minimize their risk of getting sick?
Well, we've talked a lot about hand hygiene, and for good reason. It's truly one of the most effective ways to prevent the spread of germs. Make hand washing a habit, not just during cold and flu season, but year-round. Wash your hands thoroughly with soap and water for at least 20 seconds, especially before eating, after using the bathroom, and after being in public places. And if soap and water aren't readily available, keep an alcohol-based hand sanitizer handy.
It's like having a portable shield against those invisible invaders. I know I've become much more diligent about hand washing in recent years, especially after everything we've learned about viral transmission.
It's a simple yet powerful habit that can make a world of difference in protecting ourselves and others.
Now, beyond hand hygiene, what other preventative measures can we take?
Be mindful of your surroundings and try to avoid close contact with people who are visibly sick. It's not about being rude, it's about protecting your health. If you're feeling under the weather, stay home to prevent spreading the illness to others.
It's a small act of kindness that can have a big impact on public health.
And of course, vaccination is a crucial tool in our preventative arsenal. The flu vaccine in particular is recommended annually for everyone 6 months of age and older.
It's like giving our immune systems a sneak peek at the flu viruses that are likely to be circulating so they can be prepared to fight them off.
Exactly. And while the flu vaccine doesn't protect against all strains of the flu, it can significantly reduce your risk of getting sick. And if you do get sick, it can lessen the severity of your symptoms.
It's like wearing a suit of armor during flu season. Now, beyond these specific measures, what about our overall lifestyle? Can our daily habits influence our susceptibility to these illnesses?
Absolutely. A healthy lifestyle is like a foundation for a strong immune system. Eating a balanced diet rich in fruits, vegetables, and whole grains provides your body with the nutrients it needs to function optimally.
It's like fueling our immune systems with premium-grade energy.
Exactly. And don't underestimate the power of sleep. When we sleep, our bodies repair and regenerate, allowing our immune systems to recharge and strengthen their defenses. Aim for 7 to 8 hours of quality sleep each night.
Sleep is like a nightly reset for our immune systems.
And just as important as rest is movement. Regular physical activity boosts circulation, strengthens muscles, and helps our bodies fight off infections more effectively.
It's like giving our immune systems a workout, too. But what about stress? I know that stress can take a toll on our overall health. Does it also impact our immune systems?
Absolutely. Chronic stress weakens our immune systems, making us more vulnerable to infections. Finding healthy ways to manage stress, such as exercise, meditation, spending time in nature, or engaging in hobbies you enjoy, can help keep your immune system strong and resilient.
So it's all about creating a balanced lifestyle, nurturing our bodies with nutritious foods, prioritizing rest and movement, and finding healthy ways to manage stress.
Well said. It's a holistic approach to well-being, recognizing that our physical, mental, and emotional health are all interconnected.
This has been an incredibly insightful conversation. I feel like I've learned so much about these common yet complex illnesses, and I'm armed with a toolbox of strategies to protect myself and those around me.
It's been a pleasure sharing this knowledge with you and our listeners. Remember, knowledge is power, and by staying informed and proactive, we can navigate cold and flu season with confidence and resilience.
And as we wrap up this deep dive, I want to remind our listeners to like, share, and subscribe to Visions Beyond for more fascinating explorations into the world of health, science, and beyond. And if you have any suggestions for future deep dives, be sure to leave a comment below. We love hearing from you.
Until next time, stay curious, stay informed, and stay healthy.